Hello, and welcome to Voices Unveiled, an audio podcast from Women for Biodiversity, where we share women's stories from different corners of the world. I'm your host, Sumina. In today's episode, we will explore a critical yet often overlooked topic, that is the intersection of gender and chemicals. Joining us today are two fantastic experts, Anna Holthaus, who's the project lead for gender and chemicals at the MSP Institute, and Sherika Whitelocke-Ballingsingh, who is a board member of the Gender and Chemicals Partnership and who is also the Poison Information Coordinator at the University of Technology, Jamaica, to uncover why gender matters in chemical safety and policy, the real-world impacts of chemical exposure, and the vital work of the Gender and Chemicals Partnership. So get ready to hear insights that will challenge your perspective and perhaps inspire actions for a more healthier and equitable world. But before we dive in, please subscribe and follow Women for Biodiversity on social media. Our handles are in the description box. Your support means the world to us. Hi, Sherika and Anna. Thank you so much for joining us today from two very different places on Earth. Anna is joining us from Germany and Sherika from Jamaica. So let's begin with your personal stories. So what initially drew each of you into the field of gender and chemicals? Was there a specific moment or experience that sparked your passion for this issue? And I'll start with Anna first.
Yeah, thank you so much. And first, thank you, of course, very much, Samina, for inviting us to this podcast. I've already listened to some of the other episodes to learn from the great speakers and our colleagues you have interviewed. And I'm very delighted to be here now and be part of this podcast. So to your question on my personal story, when I was 19, I did a voluntary service year in the field of ecology. And there I attended the UN climate conference COP15 in Copenhagen. And there I was part of the civil society protests. And that was really the first time I met people from around the world fighting for a healthy planet, and including many inspiring women. But COP15 then turned out to be a massive failure, and it was really deeply discouraging moment for the international civil society movement. The mood was not so well, but because of that, soon after I began studying environmental sciences, and during my bachelor's program, I took a course on gender mainstreaming and sustainability, and there I discovered how much these two approaches have in common and how much they can learn from each other. And there I learned about the success of women's movements and their impact on sustainable development debates, which, I would say really gave me renewed hope at that moment. And with this course, I also came to understand how the devaluation of care work is really deeply connected to the devaluation of nature in our capitalist world. And I think this concept is really essential to overcome if we want a truly sustainable future. And in addition to climate change and biodiversity loss, the pollution crisis caused by chemicals and waste is the third pillar of the triple planetary crisis. It really urgently needs much more public attention. And similar to the climate and biodiversity crisis, global pollution is not only escalating, but also has gender differentiated impacts and worsens existing gender inequalities. And this intersection is very often overlapped. And that's why I'm deeply passionate about addressing it.
Thank you for that, Anna. I would like to ask the same question to Sherika as well, please.
Thank you so much, Samina. For me, I'm a public health specialist. And so first I worked as a public health inspector for the Ministry of Health in Jamaica. And during my tenure of working, I actually saw the first-hand experience of how chemicals impact different gender, how it affect men differently from women, boys differently from girls. And this was mostly like in the within the farming sphere, within household chemical sphere. Years after I transitioned from the ministry to the University of Technology, where I managed the Poison Center, I started looking on some real data on the accidental poisoning in our country and trying to understand more about the scope of it, what it is that is affecting different persons in different areas within our society. But the interesting part about what stimulates this passion was when I was actually introduced to the gender and chemical concept within the UN group discussion and MSP Institute, because I'm working on all of these chemical exposure issues on a daily basis, but I've never actually taken that insightful look on how disaggregated data on gender can give me more information for intervention. And that's what stimulates the passion. Being a part of the partnership group with MSP Institute, working with the Women's Major Group and with IPEN in the UN sphere, it gave me a broader knowledge, a more global understanding of this impact. And it drove my passion to want to do more and more in that area.
Thank you both for sharing your passion and for condensing that into a few sentences of what is a career-long advocacy for both of you. And you both have mentioned about the gender differentiated impacts on chemicals. But for those who are less familiar, what does gender and chemical mean actually? And how are they interrelated?
So yeah, it's really broad. Chemicals are everywhere, and the also gender dimensions are multidisciplinary. And looking at gender and chemicals is a multidimensional exercise. This needs to pay attention to scientific risk assessment, as well as cultural and social factors, decision-making procedures, education, and governance processes at all levels. And we at the MSP Institute always differentiate between three main interlinkages of gender and chemicals. And these are first, biological aspects, second, social aspects, and third, the transformative potential of the gender perspective. So first, with the biological aspects, I mean that women's and men's bodies are affected differently by certain chemicals. This is due to the different body composition and hormone levels of women and men. And in addition, mostly women go through different life phases than men, such as pregnancy, breastfeeding, and menopause. And during these phases, their bodies are more susceptible to health damages caused by chemicals. And these biological differences have not yet been sufficiently researched, and sex and gender disaggregated data on chemical exposure is often lacking. And it's very important on that biological aspect is also that chemical exposure can be passed to the next generation through the placenta and during breastfeeding. But not only women can pass it to the next generation, also men, because poor sperm quality during fertilization can also harm the resulting child. And we know that sperm count and quality have declined by more than 50%, and modern chemicals are believed to be one reason for this. And passing this burden is, of course, a question of intergenerational justice. One example for this is per and polyfluorinated alkali substances, in short PFAS. More and more in media, and they are, for example, used in pants and in outdoor clothing, and many of them have health effects are gender specific, such as testicular and breast cancer, and some of the health effects also affect the next generation. For example, a reduced response to vaccines. I think very important to have a look at that. Secondly, beyond the biological aspects, their chemical exposure is often influenced by various social gender aspects. And women and men are affected differently because of their gendered roles in society, especially due to the division of labor. Men and women come in contact with different chemicals, and due to gender roles, women and men tend to use different products. One main example for this is, of course, cosmetics, but there are also others. And these social gender aspects often receive no or clearly too little attention in chemical safety trainings and in risk assessments for chemicals, as well as in research studies. And thirdly, we at the MSP Institute always highlight the transformative potential of gender. We believe that looking at gender issues is a strategic opportunity which really offers a great potential for transforming our societies, and this is unfortunately used far too little. And we believe that using the gender lens enables us to understand and unpack root causes of unsustainable behavior, and helps us to find new solutions by thinking outside the masculine box, so to say. So this is our approach, how to handle that broad field of gender and chemicals.
Thank you, Anna. And I really liked that you said by thinking outside the quote unquote masculine box. And so this brings me to the most important question. Why is gender important in the context of chemical safety and policy?
In regards to how government, institutions, organizations formulate, create, promulgate policies, one of the important things that we have to think about is how do you analyze these data to construct something that will be so impactful to the individual. So it is vital to analyze inherent biological distinctions such as hormonal differences and metabolic rates. And this can be influenced by the individual response to chemical substances. And we can infer that from what Anna would have said about the biological and the physiological differences and how women hormone respond to chemical exposure in compared to men. Further, we must recognize how societal roles and expectations can shape exposure risk. So, for example, in Jamaica, we have the occupational health and safety standard that has been on green paper for years. And how will this policy, how will this standard speak to how industries operate in Jamaica? What it is that we would be looking for in the standard, particularly in contexts like occupational hazards, we'll be looking at household chemicals, where gender dynamics might play a significant role. And so when you prioritize these comprehensive understanding of these factors, we can effectively advocate for specific policies. We can put certain practices and safeguard for the health and well-being of all individuals, regardless of their gender. We can commit to investigating the intricate interplay between gender, chemical exposure, and whatever confounding factors that would factor into safer and more equitable future where everyone has the opportunity to live free from the adverse effects of hazardous substances. And once we can recognize these important aspects, we are able to safeguard human health, safeguard the environment, but moreover, men that may encounter risk related to occupational exposure, for example, to heavy metals or to toxic fumes, which can affect their sperm count quality, as Anna spoke about, that impact on the sperm count quality and the overall reproductive health for both women and men. We can have an understanding of where it is that we must put emphasis in our policies to target different areas for better intervention, for safer measures, for educational programs to address these distinct vulnerabilities within the population that are faced by different genders in various environments.
So then it has got me wondering who is most affected by this issue.
So I'll go before Anne on this one. So in my context at the Poison Center, the community or the persons that would be mostly affected contextually, we talk about children. So when I would look on my accidental poisoning data that comes out of the ministry, for 80% of our confirmed cases, children are mostly affected. And then when we look on industry and the work that has been done in terms of who uses what chemical most, for most of the cleaning and office work environment, women are being impacted. In regards to pesticide industry, men are mostly affected, but they're not the only one that are affected. The women who work with the men are also affected, but because men are at the top chain of the farming industry, for that population, men would be mostly affected. So what we see happening is that you have the agricultural industry where there are different gender roles, you have the manufacturing sector where there are different gender roles, but moreover, the long-term health repercussion from exposure to toxic substances, it really can be disproportionate amongst men and women. So it's within whatever context that the chemical is being used in and who work in those areas. And that's where it is important for the discussion on the gender aspect of chemicals. And so I'll hand over to Anna to add her perspective on this.
Yeah, thank you so much, Sherika. I absolutely agree with you. And maybe let me just add one thing. We already lack sex and gender specific data for women and men, but there's almost no data on chemical exposure for intersex people. And according to a scientific paper I've read 2 weeks ago from the toxicologist Dylan King from 2022, he's saying that even the most conservative estimates say that about 1 in 5,000 people are intersex, and that this is the same rate as certain genetic mitochondrial diseases, which are studied for environmental risks. So he's raising the question, why isn't the same care given to intersex people? And I believe if we don't study intersex individuals in the context of toxicology, we of course fail to ensure their safety. And beyond women, also this group is something we can learn more about and detect more on chemical exposure by using the gender lens.
Thank you both for paving the way to my next question, because I was about to what I'm trying to ask is that, are there stories visible in mainstream discussions or at global policy spaces? The groups that are most impacted by chemicals, are there stories visible in mainstream discussions or at global policy spaces?
Yes, and we can reflect. There are numerous stories that are visible. When we talk about the narrative of individuals who are mostly affected and the interplay of gender and chemical exposure, it is oftentimes overlooked both in the discourse of international policy making and also in local policy making. Now, the lack of this data, it creates the unique challenges that are faced by different groups. And I can still infer from what Anna would have said about the different sex group. What are the quality and type of data that we have for different groups that are affected to see how these policies can be promulgated from the international level and then filter down into the country level. So what do I mean by the lack of representation? It means that unique challenges that are faced by these groups, such as women, vulnerable population, who would have encountered hazardous chemicals in their daily life, it remained largely unaddressed. It remained unaddressed through inadequate discussions, through the absence of policies, through the absence of legislations, through the absence of standards, through the absence of regulation. And these experiences, they are very unique, they're meaningful, and these experiences, they often come with health implications, socioeconomic challenges, environmental injustice, which deserve a lot more attention, understanding, and a wider discussion to shape the global context on these regulations for more public health initiatives. And I could provide a particular example that any country maybe could reflect on when they're thinking about gender policy. When you look on your data within health, can you constructively think about which sections of your population, whether it be men, women, boy, and girl, who are mostly affected by specific categories of chemicals, and how it is that your health programs are planned on an intervention basis to impact positively those areas. Oftentimes, that discussion is missing from the mainstream discussion.
My next question is to Anna, actually, and building on what Sherika has just talked about, is that I wanted to ask if you could provide an overview of the work of the Gender and Chemicals Partnership, of which Sherika is also a board member and Women for Biodiversity is also a member of. Perhaps maybe you can share the key goals and how does this partnership address the critical gaps that Sherika also touched upon in her answer to protect all genders from the harmful effects of chemicals, waste, and pollution.
Yeah, thank you so much. Of course, I'm happy to share more about the Gender and Chemicals Partnership. It's a global multi-stakeholder alliance that we officially launched in 2023 at the International Conference on Chemicals Management in Bonn. And what brings us all together is the shared goal of addressing the global pollution crisis through a gender equality lens. It's a multi-stakeholder alliance, and our members include governments, UN agencies, researchers, civil society groups, women's and youth organizations, and also actors from the private sector. Yeah, and why did we establish a multi-stakeholder partnership on gender and chemicals? We believe that the gendered dimensions of chemicals can be found across industries and in various realms of life. And so this makes it an issue that has to be addressed collaboratively via a multi-stakeholder approach. And we've seen that various international policy instruments now acknowledge the need for gender responsive approaches. However, despite this international recognition, gender responsive chemicals management has hardly been implemented anywhere in the world. And against this background, the idea of a multi-stakeholder partnership came up in the run-up to the World Chemicals Conference in 2023. And the GNCP, so our Gender and Chemicals Partnership, aims to bridge gaps and improve the impact of global gender responsive chemicals management by bringing together the key stakeholders. And our work focuses on a few core areas. First, we want to raise awareness and advocate for gender to be integrated into global and national chemical policies, like, for example, the BRS and Minamata Conventions, the Global Framework on Chemicals, as well as the newly established Intergovernmental Science Policy Panel on Chemicals, Waste and Pollution. Second, we want to support research and data collection, which we were saying that both is very urgently needed. And we are, for example, planning to develop a knowledge platform on gender and chemicals in the coming month. Third, we are planning to develop trainings and educational material, for example, for national chemical focal points. And in the future, we would like to also support the different stakeholders with implementation activities on the ground. And currently, we have over 20 members from various stakeholder groups. Yes, including you, Sherika, as one of our board members, and Women for Biodiversity. And we have at the moment 4 working groups which meet virtually on a monthly basis to coordinate their efforts. Yeah, and the Gender and Chemicals Partnership is open to all stakeholders who are committed to mainstream gender considerations in their work on chemicals management. So, if you listeners are hearing this and you would like to get involved, then we would love to hear from you. Just send us an email and we'll get in touch. Yeah, that was my short commercial break for joining the partnerships. Thank you, Samina.
Thank you, Anna, for that. Shout out to our listeners as well. I actually liked it because it feels very accessible. It feels like a place you can actually, contact people and just pour out your thoughts, even if it's gender.
Absolutely, yes.
Yes, and so many of the advocacy spaces is not accessible to a lot of people out there who are very interested but might not be technically knowledgeable, for example, but they are interested. So I see gender and chemical partnership filling up that gap for sure, definitely. So moving on. So what are some of the biggest challenges you both have faced in advocacy for gender mainstreaming in chemical policy? So have you ever encountered pushbacks, and how did you navigate this?
So I would say yes. We face increasing challenges when doing advocacy work for gender mainstreaming in chemical policy at the moment. In the recent international meetings on chemicals management, we've seen how the topic of gender has become part of a broader cultural and geopolitical struggle. And countries like the US, Argentina, Iran, and Russia have instrumentalized the debate to push back against progressive policy. And with that, turning what should be a constructive policy conversation into an ideological debate, often reduced to arguments over the very definition of gender. And that reduction, in my view, completely misses the point. Gender is not just about recognizing people who don't identify strictly as women or men. Although, of course, that recognition is very important, but gender is much more. It is a well-established field of research aimed at understanding one of the key structural inequalities in our world, really affecting everyone. And it is also a globally recognized strategy in organizational development and project management, with more than 30 years of tools, methods, and evidence behind it. And to just reduce all of that to a cultural or semantic argument that then discredits LGBTQI plus individuals, I don't know, is very bitter. And this was the case, for example, within the context of setting up a new science policy panel in June this year. And what's more is that these superficial debates also in the end crowd out much more pressing policy conversations about health impacts, about exposure risks, and policy strategies. And it is a tactic to use by certain states to delay real progress. And I would say that is deeply frustrating because it diverts time and energy away from making chemical policy scientifically sound and effective. And the only way I think we can handle this is, with simply dismantling this tactic clearly and to raise awareness about the richness of gender and the transformative potential of gender approaches for policymaking.
And to add to Anna's strong point, very resonating point Anna gave at the end when she spoke about the richness to the gender and transformative potential for policymaking. From a public health perspective, if you don't have a clear understanding on how the concept of gender data really affects or understanding of surveillance data when it comes on to especially chemical exposure, we're missing many opportunities. So some of the drawbacks and the pushback has to do with this misunderstanding of what gender means in different society according to chemical exposure. And I'll give you some typical everyday situation across the different UN region. In our context here, within, say, the CARICOM and within Latin America, we are faced with the pushback of understanding, okay, women who work with a particular chemical in certain industries, they are affected more. So for a lot of the janitorial services that are being carried out, whether it's in a hospital environment or whether it's in an institution, majority of it's carried out by women. And the chemicals will affect women in different ways. These same women, they go into their homes, they are the nurturers for their homes, they look after their children. If you should ask for a workplace policy that looks on even a specific type of insurance package for some of those women, you will get a particular pushback. But when they go into the health setting, when you have these bioaccumulation of these chemicals within their systems, and after 10, 15, or 20 years, you are seeing a particular changes in the female reproductive system, you are wondering what is happening and what can be done. But you open that discussion, it might be shut down. When you look on the farming community now within our region, where for some countries, apart from only men being affected, children who live in those farming communities, both boys and girls, they are also affected on different level. They're affected through the exposure, whether they have to do harvesting or whether they have to work with their family in the field. And that's just on our regional level. When you look on the data now within, for example, within Asia, the countries within the Asia regions, you realize that the gender dynamics and the norms, it might shift a little bit different from that within the CARICOM and Latin America region. So you're seeing for specific industry, like maybe the Samsung issue that has been brought up many times for exposure amongst workers, you might see that up to 80% or more of those workers are female. There are certain jobs that within certain society, it is assigned to a particular gender. And understanding the gender context and the gender dynamic plays a key role in this transformative conversation, in transforming and revamping our policy to understand the true reasons of the problem. And if we do not understand it, we will continue to have these problems. They will not be removed from society. They will not be removed by playing the semantic word language issue, as Anna would have alerted to. That does not help. And these same countries will continue to carry these intricate health burdens that are the result of non-discussion, absence of gender transformative policies looking at real public health issues. And so it was a very, very important point that Anna brought up that I must elaborate on.
But have you seen any success stories where gender transformative chemical policy has made any form of tangible impact?
Yeah, because Submina, it's a tricky question. If we're talking about impact in the sense of measurable, large-scale change, I would say we are still at the early stages of bringing gender considerations into chemical management. But yeah, if we look at process indicators from a policy perspective, I would say that we have reached a very important success milestone, because at the international level, major frameworks and conventions on chemicals management now include gender equality as a key principle and have also established gender action plans. And these gender action plans, also, of course, we know them from the CBD process. They are designed to mainstream gender considerations into every aspect of their work. And that's why governments and funded projects in chemicals management then are now required to integrate gender into their national policies and programs at the global level. And but maybe for me, it's also sometimes the small stories that, truly capture the success of the work that we are doing. And I want to share one moment, because I think that is something I will never forget. After a presentation that I gave at a university, a chemistry professor told me that during my talk, it was really the very first time that she had realized that her safety glasses had never fit properly in all her years of the job. And most likely because they were designed for the typical male colleague. And that's a common issue with personal protective equipment, and that was part of my talk there. And so the professor, decided that she wasn't going to accept it anymore. And I love that story because it shows how structural gender inequalities quietly shape our everyday lives, and that simply being aware of them is or can be the first step to change. And so that was really a success story for me. But maybe Sherika, you can present a little bit more.
Yes, and Anna, your success story now will add to what it is that I have to say, because stories like yours, they spill off in many different ways. When I was in mainstream public health, I'd work at a facility where, for different reasons, persons were exposed to chemicals. And they got sick for many different reasons. And it's out of doing a presentation on a particular day, just a training and a presentation, then workers start coming to me and they start reporting things that were happening to them and things that were happening to others. And out of that discussion, Anna, like you spoke about the person who listened to your presentation and realized that, my protective gear was not fitting properly anymore. Out of that, I was able to work with the team to actually have a policy in place that this is how this particular group will carry out this disposal of chemicals. This is how they'll transport it. This is how storage will be done. This is how disposal will be done. And what that did was it actually created a positive impact. So you had less persons being affected by exposure to those chemicals from that particular group, and you had them being more proactive in doing and citing things before they happen. I remember once there was a leak somewhere, and out of the training and out of the policy that was in place, one of the staff member from that group alerted me. And the team was able to go in, and we were able to mitigate because of the training and policies that were put in place from these experiences. And they're small but very good and meaningful experiences. These are small models that can be used into greater models to transform different sectors, different societies, and different economies.
Wow, thank you for sharing those powerful anecdotes. I mean, these are the small wins that really add value to our work, I feel. And I think you both feel the same way as well. So now we've reached the end of the podcast, and before we leave, I wanted to ask, what gives you hope right now? And why should the world care more about the intersection of gender and chemicals?
Yes. So one of the things that gives me hope right now, it's this podcast. It's having the opportunity to be able to share this information on different platforms for all persons to hear and to understand. And it gives a hope because the information is not within a box now, but the information is there for any and everyone to get. Another thing that gives me hope on a personal level is the different groups that I've been working with over the years. I've been working with the International Pollutant Elimination Network. I've been working with MSP Institute in their partnership. I've been working with the Women Gender Major Group, and I've been working with the Science Alliance. And the dynamics within our group, it drives courage. It gives us hope. It sets a platform for us to advance our work, for more research, for more open discussions, for getting different stakeholders to be a part of the conversation. And there is no more hope than that hope, where everyone has been engaged in a process, everyone has a seat at the table, and everyone has been able to discuss their problem in the most applicable, in the most constructive way on the way forward. And that is hope. That is true hope.
Yeah, thank you. And very similar to you, Sherika, I also actually find a lot of hope in how much momentum the topic of gender and chemicals is gaining in other spaces than just the international negotiations. I would say that public awareness is growing. More and more stakeholders are actively engaging with the issues. Over the past few years, we've seen a noticeable rise in organizations that include the gender dimensions of chemicals management in their work. And of course, together we can have real political power. And one recent example is the Women's Caucus for the Minamata Convention, which we have launched together with Women for Biodiversity just this June. And within just the first few weeks, over 60 organizations and individuals joined, and that kind of response shows that there is real demand for a stronger, more inclusive approach to chemicals policy. And yeah, in addition to that, we've also seen continued growth in our gender and chemicals partnership. And so, in a way, maybe the political backlash on gender may even be having a silver lining. It's also motivating more people and organizations to stand up and say, yes, for us, gender matters. And yeah, my final answer to your question, why the world should care, I would say because the link between gender and chemicals exposure isn't a niche issue. It's about knowing who's most at risk and how to create a smarter, fairer policies to tackle one of the most urgent environmental crises of our time.
Thank you for staying with us until the end of the podcast. I hope you enjoyed that conversation as much as I did. If you'd like to connect with us, follow Women for Biodiversity on social media. The handles are in the description box, and please don't hesitate to share this episode. The more the merrier. You can reach us at communications@womenforbiodiversity.org. Remember, that's the number 4 instead of FOR. So until the next episode, stay strong and carry on.